does that, I am going to run a couple of quick poll questions and let me get those pulled up.
Good morning, Laura.
Morning, Chris.
Good morning, Troy. If they gave out Academy Awards for safety and the promotion of it through these webinars, you guys are rock stars.
Well, thank
Um,
you, Chris. I will say that Laura's the rock star. This is all Laura's gig. We're just here to help her.
I'm so proud just to be able to tune in on Saturdays that I'm not flying. And unfortunately, next week I'm going to be flying back from Tokyo, so I'm going to miss it. But it's almost like it makes me sad on the Saturdays, even though I'm flying. It makes me happy that I miss the content that you guys put out. It's very impactful, as well as the webinars that you're doing on Wednesdays in the evening. That's great.
Well, that's
Well,
awesome, Chris. Thanks for the kind words. And that brings me to one of the things we've been able to do as time has progressed. We've always tried to improve what we do with our webinars. We now have our Saturday morning coffee and wings YouTube channel. So if you have to miss a session for some reason, you can always go back and watch it on the YouTube. So I launched our first poll. Did you attend our first Saturday morning coffee and wings webinar in March of 2000? I'm going to end that poll and share the results. So 13% of us attended that very first webinar, 87% did not. So that's awesome. We've got people keep coming back for more. And my second question, did you ever attend a Saturday webinar at Modern? Ever, ever, ever at any point in your life? I'll be really interested to see how many people have continued following us along as we've gone throughout the years. And I am going to end this poll in 5, 4, 3, 2, 1. Share the results. And we've got 11% of the people here, which is 50 people, attended a seminar, in-person seminar at Modern at some point in time. So that's super cool. Thanks to everyone who keeps coming back, and welcome all of you new people. And with that, I am going to turn this over to Chris and his team.
thank you so much, Laura. Well, welcome everybody. Today we're going to talk about the U.S. Helicopter Safety Team, and more importantly, the U.S. Helicopter Safety Team's Peer Pilot Program. There's a QR code that you can see visible on your screen, and that QR code, if you save it, it'll take you to the Peer Pilot Program. It's online. So today our presenters, myself, my name is Chris Baur. I am the CEO of Hughes Aerospace Corporation. I'm also the industry chair, co-chair for the U.S. Helicopter Safety Team. We also have Mark Stuckmeyer, who's a USHST peer pilot, and he's also an EMS helicopter pilot. Dr. Aedrian Bekker, he's the clinical aviation psychologist for the Center of Aviation Psychology, CAP. And that's who we partnered with when we put together our peer pilot program. Dr. Jessica Oslander, she is the licensed psychologist who manages our program here at the USHST. However, she couldn't attend today for conflict, but she did record a really good video that I will play for you that talks about that. Again, I like QR codes. I'll leave it up there for a second. If you scan that code, it will take you to our portal, or of course you could do it the old-fashioned way and just type it in, and it's ushstpeer.org. And we'll talk a little bit more about how to get in touch with us in some subsequent slides. So this is me, the industry co-chair, as well as recently elected to the board of directors at VAI. My background is I've been flying for 45 years, and pretty diverse. I've been a helicopter pilot for most of that. I still fly on R-66 helicopter. I also fly a TBM, and I also fly the Boeing 787 Dreamliner. So I still enjoy flying as much today as I did when I started in '79. I'm also a CFI, double I, and a former military pilot. And and I'll talk a little bit about some of my background in terms of search and rescue and such as a first responder. If any Riddle graduates, I went to Riddle, I went to Brown for my MBA, and that's all we need to talk about me. Dr. Aedrian Bekker, I'll introduce him here in just a moment. He oversights the program at CAP. He is based out of the UK and stood this program up after the German wings incident, where a pilot did crash an airliner in the Swiss Alps, and it was a loss of approximately, I think, 150 people. Dr. Jessica Auslander, we'll see her in her video here in a moment, and she is US based and oversights the USHST's peer pilot program. She conducts the training with the peers, and Mark can talk about that in a moment. All of our peers have gone through professional training to be a peer, and they have a lot of resources and assets at their disposal when they're working with somebody. And Mark can talk about that. And I'll put Mark's bio up here, and I'll have him introduce himself as well. You can see Mark's got a very diverse background in flying, in helicopters in particular. And he also is on the National EMS Pilots Association Board, or NEMSPA. So I'll talk a moment about the USHST,
Yes.
if you're not familiar with us. The U.S. Helicopter Safety. Oh, I'm sorry. Go.
Hi. No, you're good. How about a poll question?
Sure. I'll stop talking for a poll question.
Well, awesome. So our first poll question, does a pilot need to report to the FAA participation in this pilot peer pilot mental health program? Yes, no, or not sure. So pretty simple choices there for early in the morning. We'll let that run, and I will end this poll in 5, 4, 3, 2, 1. And I'm going to share the results with everyone. So 6% of us say that you do need to report participation in this program to the FAA. 54% say no, you don't, and 40% are not sure.
Well, for those who say yes or not sure, that's incorrect. You do not need to report participation in a peer pilot program to the FAA, to your AME, to anybody. That's a private matter between you and the person that you're talking to as a peer. And the FAA made sure of that, because the FAA encourages you to participate in a peer pilot program. Going back to the USHST, we're incorporated as a 501c nonprofit, hence the USHST Foundation, and that's what makes this peer pilot program possible. It does not involve the FAA at all. Even though the USHST is a partnership between industry and the government, the USHST Foundation is a standalone and only focuses on the peer pilot mental health, nothing else. We have a whole bunch of different support features, webinars as you're on today, podcasts, videos. We have a free app for you, newsletters, and HSEs, helicopter safety enhancements. They're like white papers. If we have instructors and students that are participating today, or pilots, and you want to read up on loss of control in flight, flying with night vision goggles, the use of simulators, aerodynamics, we have white papers on all of these called HSEs, and they're all on the USHST website. We also have our own branded merchandise, like this shirt that I'm wearing that says USHST on it. The beautiful thing about that is if you buy something, it contributes to these programs. All of it does, every bit of it. What's our goal? A U.S. helicopter community without fatal accidents. So USHST has been around since 2013. Before that, it was the International Helicopter Safety Team. And our goal this year is to reduce fatal accidents to 0.55% out of 100,000 flight hours. Who's all in the USHST? Again, you have the FAA, NASA, NTSB, and then you have different industry groups, GAMA, VAI. You have different companies such as Hughes that supports this helicopter safety initiative, as well as manufacturers and manufacturers such as Garmin, Bell, Sikorsky, Airbus, Robinson, and different operators support it as well. Where are helicopters registered in the United States? Quick heat map here. If you take a look, no surprises, a lot in Texas, California, Florida, the Northeast, up in the Northwest, a little bit in Alaska, and then you have a concentration in Hawaii. Where are the fatal accidents? Well, unfortunately, Texas is in the #1 spot, but you can see we also have fatal accidents, again, by the colors in these other states, Florida, California, Louisiana, and then, of course, up in Alaska and the state of Hawaii. Where are FAA weather cameras located? Well, unfortunately, most of them are up in Alaska, which is great for Alaska and Hawaii, but you're not so much here where you have a lot of the fatal accidents. And the USHST is advocating for more weather cameras. If you're not familiar with them, you can go to the FAA's website and look at them, or you can download the Hughes app. And we put all of the weather cameras for free in the app so you can pull them up in the palm of your hand. And the FAA says that these weather cameras reduce fatal accidents by 80%. We talked about HSEs, where you can go to find them. Scan this QR code, it'll take you there. It's on the USHST website. Podcasts, we have a whole bunch of them. We take some of these HSEs and we distill them, like improving a safety culture, managing risk in flight, and you can listen to them at your convenience. We also work with the Rotorcraft Collective. In fact, last night I was at FAA headquarters recording another video. So if you go to the YouTube channel, and this QR code will take you there, you can see these are really short videos, about 3 minutes or so, and you can see feeling the pressure to fly, just say no, personal electronic devices can cause distractions, and these are ones that we have in production right now that'll be coming out. 56 Seconds to Live, another really good video that's on the USHST website. And you'll notice we have a tab on the USHST website for mental health. So that's another way to get a hold of us. If you just Google USHST, go to the website, you can click on mental health. So I'm going to show you a very short clip. You may recognize me in this video. And this happened back in 1996. This is, I think, a really good example of a first responder.
The ship had to come back in because the seas were so rough. We're split up and confused. Helicopter pilot Fritz Meyer of the Air National Guard is keeping a keen eye on the investigation. Meyer happened to be flying a training mission the night Flight 800 exploded, right in front of him.
The only thought I recollect is curiosity regarding what the hell is that? And as we began, of course, we knew it was something devastating when we saw the fireball. And
after a few days to think about it, Meyer says the most emotional moment for him was seeing an armada of volunteer boaters coming out to help.
And I saw people doing their duty as they perceived it in an ugly situation. And that moves them.
Grim work indeed. Now,
so what I wanted you to see there is back in the day when we'd go out and do these missions, there really wasn't anything there. You can see that Fritz, who by the way is no longer with us, was really suffering a little bit. He didn't really have anybody to go and talk to, didn't have anybody to explain what his thoughts and his feelings were. And back then, I don't think anybody cared if you had them. And that's not the case today, not the case at all. And whether you're a first responder, if you're a pilot that, encounters some turbulence in your life, that's what this program is here for. The ability to talk to a peer. No cost, no judgment, nothing but assistance for you. I put this QR code up. This is me flying the another rescue mission. You can read about it. This is one where a ship sank in the middle of the Atlantic. And when we got out there, we found the bodies of the survivors being eaten by sharks. So will all that stuff catch up with you? It can. So we put this stuff out here so you folks can have a place to go. Now, I'm going to introduce Aedrian again and have Aedrian come on and talk a little bit about what the FAA put together in terms of the ARC and what the ARC is and what the fundamental change has been in the FAA towards mental health and peer pilot programs.
Sure. Hi, everybody. Great to be here. A real honor to be on this illustrious and famous webinar. And so just by way of introduction, as Chris was saying, I'm an aviation clinical psychologist, and we got involved and became specialist providers for peer support quite a while back. As Chris referenced, the big wake-up call around pilot mental health in Europe was Germanwings. And as a result of that, there was a mandated requirement across all United Kingdom and European operators that they had to provide access to all their pilots access to peer mental health, peer support programs. And while, as you'll hear shortly, peer support has been around in the US for quite a while. It's been typically hosted by the large operators, the fixed wing operators. But more recently, it's really gathered momentum and speed. There was a congressional hearing in December 23 looking into why is it that aviators, and then it's not just pilots, but everybody in that safety envelope, maintainers and air traffic controllers, flight attendants, and so on, why aren't they seeking out mental health support when they need it most? And I'm sure it comes as no surprise. Most people listening here would think, well, it's pretty obvious, there's jeopardy attached to it. And if I were to raise my hand when I was going through a difficult time in my life could get even more difficult because I may be grounded and may take me a long time to get back in the air again. So the FAA really looked into trying to understand what was it at a systemic level or at multiple different levels that prevented aviators seeking that help. And then they published their findings in the ARC, the rulemaking committee, on the 1st of April last year, 24. And I must say it's groundbreaking because it looks at every level of every level of a system, from the individual to the corporate to the regulatory, and they're going about working very hard to implement a lot of those recommendations. But at the crux of it, it is really saying, actually, we really want our aviators to seek out peers for help if they're experiencing a difficult time. Peers, as you'll hear shortly, they're not licensed mental health professionals. They're not intended to be. They're there to support a colleague and often are the first step, because the real challenge is just to lower the barriers and really encourage people to ask for help. And often that is the gateway to getting additional help that they need, or in most instances, that's actually all the help they need in the first place. So very happy to talk more about that. But I'm going to hand back to Chris because there's more of the story to unfold. Over to you, Chris.
Well, thanks, Aedrian. So if you go to ushstpeer.org or scan that QR code, it'll come up again too. It'll take you to this portal and you can click on Speak to a Peer. And when you do, it'll bring you to a different tree. If you don't want to go that way, you can go into the Apple iOS and you can download the Hughes app for free. And you can join the USHST on the Hughes app. And when you do, you get a membership card and a membership number. You can also do this on the USHST website. So we're giving you many different portals to communicate with us and get in contact with us. If you go through on the Hughes app, just tap on the menu and you'll see that there's a hot link to the USHST website from the app. Click on the menu button, and then on mental health, you'll see that there's two different tabs you can go from there, the Resilience Hub and the Peer Pilot Program. Aedrian, maybe you come back and talk a little bit about the difference between the two and what they do.
Sure. So when we look at sort of well-being or mental health, there are two ends of a continuum. There comes a point for somebody where they really the wheels have come off and they need help from somebody else. And that's generally, or support from somebody else to talk an issue through. And that's where peer support comes in. It's more the reactive side. But what we also know is that even before that point, often people, aviators, are aware that something's not going well on in their life, and they want to understand and educate themselves better. And there's a lot of good stuff out there. But what we wanted to do is create a sort of a home for a whole bunch of materials, educational materials that pilots and aviators can access to educate themselves about a whole bunch of things that affect aviators in very unique ways, such as fatigue, relationships, health, etc., etc. So we created what's known as the Resilience Hub. So when you click onto the USHST website and you click on the mental health tab, you will have an option of either going to the Resilience Hub or to the peer support program. And the screen you've got on in front of you now is the peer support program. And obviously, it's a very simple website. It hopefully explains and reassures the aviator as to exactly what this is. It's independent, it's confidential, it's non-judgmental. And hopefully, if they've satisfied themselves and yes, they would like to speak to a peer, all we need at this point is just contact details. Doesn't even have to be your real name. We just need a number to make contact with you. And then that gets submitted to us. And then we process that and then farm that out to our peers. And so the way it happens behind the scenes, we receive that. We then send out a message to all our peers saying, is anybody available, potentially with these criteria that have been requested, within 24 hours or 7 days, and potentially female or captain, first officer, whatever the requirement may be, trainer, PEMS, search and rescue, whatever. And then we make a match. And the peer then will make contact with that individual, and they'll arrange a time to talk, and then they set that up. Now, behind the scenes of that is the peers, remember, they're not qualified mental health professionals. They're not intended to be. They're just meant to be that first point of contact. Just somebody who knows what it's like to walk in the shoes of an aviator in this particular part of the industry. But behind that is some very strong support and supervision, and we'll hear from Dr. Jessica Auslander in a moment in terms of how that works. So the peers at every point are supported so that we can make sure that the user of the service gets the help that they need. And as you can see, the slide that you can see in front of you here, well, firstly, if I maybe just point to that little laptop there, you'll be interested to know that actually there's a wide range of reasons that people use peer support. Our data, and we're starting to grow quite a heck of a database, building both here in the US and also in the UK as well, in Europe as well. It turns out that most people use peer support for exactly as you'd expect. It's the day-to-day act of living, the stuff that gets in the way, relationships, behavioral issues at work, health issues either with yourself or people around you. And of course, the things that you'd expect would affect aviators in a very particular way, such as the fatigue and exhaustion, and particularly training. Training's a big deal, and it's becoming more and more a bigger issue that people are looking for help and support from peers. But the most important thing is, as you can see here, and this is what I think is quite exciting and groundbreaking for this program, is that it's entirely free for not only the user but also their employers. Through the generous sponsorship of the USHST, they've made this service available. And as far as I know, this is the first service of this kind in the world, particularly focusing on helicopter pilots. We have a similar service in Europe, but it's configured in a different way, not in an all-expansive way in this particular reach. The main thing to remember, though, is whoever uses it's entirely confidential. And it's completely independent of the employer, the FAA, and particularly the USHST. Nobody has access to any of that confidential data. We are the custodians of that, and we facilitate the contact between the user, the peer, and that's overseen by Dr. Jessica Auslander. Chris, over to you.
How about a poll question, guys?
Sure.
Excellent.
All
Great
right.
idea.
I just launched our next poll question. Since the USHST's Peer Pilot program is completely confidential, will my employer or the FAA receive notification? And the choices are yes, no, or not sure. We'll let those come rolling on in, and I will end this poll in 5, 4, 3, 2, 1. Here's the results. 2% of us said yes, the FAA or employer will receive notification. 90% said no, and 8% are not sure.
That's good. I think folks are even though it's a Saturday morning and it's a little early, depending on what part of the world or the country you're in, they're paying attention. So we launched this program, and as Aedrian points out, there is and has never been a independent peer pilot program for helicopter pilots. The airlines were kind of pioneers in this space, and they've enjoyed outstanding results using a peer pilot program to address these issues. And the helicopter community at large needed it as well. So right now we've got 8 volunteers that are trained to be peer pilot counselors. They're going to go through recurrent training every year. And if there's interest in becoming one, we'll maintain a roster of folks as the program grows. If you're not a first responder, if you're not, say, an EMS pilot, if you're not flying any one particular mission, if you're a private pilot, if you're a student pilot, if you're an instructor, it doesn't matter what you do. What matters is that you know that we're here for you. We don't say, oh, we give priority to certain people or anything like that. In fact, if you're a fixed wing pilot, we're non-denominational. If you're in distress, we're here and we will support you. We do not discriminate against fixed wing people. So I was plugging it before. I'll give it another plug. Support the USHST. You can go to our site and click on USHST store. And we sell everything from survival tools to the coolest challenge coin ever. They're all limited edition, and it has an actual rotor on it that spins and glows in the dark. It's pretty cool. So we hope you support us in supporting you in our community. So now I'm going to give it to Jessica Oslander, who's not here today, but she recorded this video, and it's very insightful as to how the program works.
Everyone, my name is Dr. Jessica Oslander. I'm a licensed clinical mental health counselor and licensed clinical addiction specialist in Charlotte, North Carolina. I am the U.S. mental health lead for the Center for Aviation Psychology. And I'm really sorry I can't be with you in person today, but I am traveling. So I wanted to make a quick video to introduce myself and answer some questions I frequently get about peer support, such as what is it? What's aviation mental health? And, what does the FAA say about this? Will this affect my medical? So I have been working in aviation mental health for about 14 years. And before that, I was working in peer support and critical incidents teams for other professions. So we know that it works. We know peer support is a great resource in kind of the prevention side of a mental health continuum, right? We talk about aviation mental health. I look at it from a wellness lens. We're all kind of moving back and forth depending on what life is doing to us from day to day. We know aviation is a highly stressful and specialized field, so it's normal to have those ups and downs, but you're expected to be in control at all times, and that's great. Most of you are probably great at compartmentalizing and focusing on finishing the mission, but what do you do when the mission's over, the ship's over? How do you break that down, right? How do you unpack all of that and go back to your personal life? And sometimes that can be really challenging. Peer support works really well because you're talking to another pilot. You don't have to explain things. You don't have to, break down acronyms or jargon. You can use dark humor. You can use bad words. They're not going to judge you, right? They know what you're going through because they do it too. So we know about 80% of calls that come to a peer support group stay in that peer level because the most valuable thing they can give you is that connection, right? They get it. They're living this life too. They have training in psychological first aid, suicide identification and response, active listening, all these great skills. And when you call them, they're not going to judge you. They don't know you. They don't know your friends or family, so feel free to talk about anyone you want. But they're going to help you figure out what's going on and what your next best step could be. And interaction with the peer will include an initial call, maybe 1 or 2 follow-ups, depending on what you need.
I know the audio on this is kind of low, so I was seeing if there's a way I can try to make it louder in our.
To train and oversee the peers as that licensed mental health professional. So if something were to come up and you need support beyond that peer, that's where I come in. I can help you figure that piece out. So we know aviation mental health is super important, not just from a safety lens, but from your quality of life. You are a human being. The brain is an organ of the body like any other organ. It's going to need care and support as we go. Yep, peer support is great for prevention, but as things continue, need more support, that's okay too. The FAA has released 2 aviation rulemaking committee reports over the past decade. The ARC in 2015, in response to the Germanwings crash, was focused on pilot fitness. And what that ARC did is said, hey, we need to start to create and encourage the use of peer support programs. So most of the fixed wing world, particularly airlines and their unions, have had peer support programs since 2015, 2016. A couple did it before then, but most of them have been developed in the last 10 years or so. So most unions and airlines now have some kind of peer support right in that fixed wing space. So I know this is new to offer it in the helicopter world, but just know that it is not new to those of us that have established and are running the program. We've been doing this for a long time. With that ARC, it was focused on that pilot fitness. That got us started. That was great. Other changes happened within the FAA, like for the antidepressant program and things like that. But we got a lot more ground covered in the last year after the 2024 ARC that was released April 1st. And that focused on specifically pilot mental health. And that is a public-facing document. You can Google FAA 2024 mental health ARC, and you can pull up that document. It was released April 1st. But we have seen several changes to the AME guide, specifically addressing mental health diagnoses. So if you look in the AME guide, which is also a public document, you can look at that and see exactly what your AME sees when they evaluate you. You can look up anxiety, depression, and related conditions in the AME guide, and you'll see all these new documents. We don't expect you to be medical professionals and interpret them word for word. That's okay, but it gives you an idea of how many diagnoses and what's now allowable. The FAA now allows for a history of up to 2 of 11 different mental health diagnoses. They allow for psychotherapy. They allow for what we call Z codes, which is like work-life balance, relational stress, things that people typically talk about in peer support or EAP settings. So now they recognize that, you can have life happening to you. You can even meet criteria for mental health diagnoses. It doesn't necessarily mean it's a safety issue. So now they're looking at mental health or an SMS from a safety lens. So we know that, hey, pilots are human, life happens. We want you to get that support early on. Peer support is kind of that first step. It's a great place to start. Again, 80% of issues get resolved in peer support. But if it escalates to mental health, guess what? That's okay now. So any visit to your any mental health provider, licensed mental health professional, not a peer, a licensed mental health professional, is now reportable on your 8500, but way fewer things are now deferrable. So I'm seeing most of my pilots that I see in my private practice are reporting counseling to their AME. Their AME is just checking them off because it's not a safety issue. Right? Those cases that are getting deferred are for the larger diagnoses that we all know about, things like active addiction, PTSD, ADHD, things like that could have a safety implication. Those are what's getting deferred, right? Run-of-the-mill anxiety, depression, adjustment disorders, postpartum depression, just dealing with work-life balance issues. All of those are now listed as issuable by your AME and your regular appointment if you see a mental health professional. So just understand that the FAA is taking a completely different stance to mental health. We want pilots to be taking better care of themselves, not just for a safety purpose, but also quality of life, right? We want everyone to be healthy and happy. So peer support is a great place to start. It can prevent you from getting to that point. The services are free and they're completely confidential. So when you talk to a peer, everything stays between you and that peer, unless you tell us you're going to harm yourself, somebody else, know of a situation of abuse, then legally they're required to escalate that and make sure everybody stays safe. But just know that all of that is confidential unless you hit that danger threshold. And then your employer doesn't know anything about it. The FAA doesn't know anything about it. The AMEs don't know anything about it. It's not reportable because you're not talking to a licensed mental health professional, but all of your peers have been trained and are supported by a licensed mental health professional who can support everyone through this journey. So thank you for participating in the webinar today. Thank you for watching this video. And we look forward to talking to everybody soon if you need it. Thanks. Have a great day.
I'm sorry the audio on that was a little low, but I think the message was really, really clear. Aedrian, would you maybe take a little bit of a deeper dive into the ARC, your experience with it, why that ARC changed all of the stigma maybe that goes with mental health and pilots?
Yeah, I mean, well, I'm hoping it's changing in the sense that it's the first time there's a proper acknowledgement that there are real and perceived elements of jeopardy for most pilots to seek the help that they need. I think in the past, it was just sort of people were just encouraged to speak to their AMEs, and there was a sense that the issue was being dealt with at a piecemeal level. And I think what's quite visionary about the ARC is that for the first time, a regulatory authority such as that of the FAA has looked at it at every single angle, and it's identified some really thorny issues. You know, it goes back to loss of license insurance and regulatory arrangements. Some of those issues will take many years to fix, but they're also looking at some of the things that will be very easy to fix. And as you heard from Jessica, a whole bunch of quick fixes. I think what had happened previously is a lot of aviators had found themselves in this position. You know, if you're coming up for a medical or have any level of certification, the moment you ask for help and you start claiming through your health insurance, you'll expose yourself to a world of pain. And I'm sure everybody on this call will understand what that is. And they were looking at every way of reducing that. I think there's still quite a bit of work to do, but it feels like the momentum and the interest and the enthusiasm is definitely mounting. And it's just great that we've now been able to reach out to the helicopter community, because I know the helicopter community, it's true all around the world, often feel like the forgotten children of the aviation world, in the sense that regulation is often thought about for fixed wing and large, big commercial operations. And it's important to recognize that the stresses and strains that aviators face in the helicopter community, they share with those in the fixed wing, but there are some particular stresses and strains that are very, very unique to this part of the world. And this is why this peer support program specifically aimed at this community is so important.
Indeed, there was an
How about a
incident.
poll question?
Yes.
All
Sure.
right. Are peer pilot mental health programs new? Yes, they're new to the helicopter community. No, airline unions have had great success for over 10 years, or I'm not sure. And so while those poll questions are coming in, Dustin was wondering if it's possible to get posters to provide some of the information in accessible locations at helicopter bases.
We are considering doing that, along with distributing more of these ID backers, which you can put on your ID lanyard or whatever, and it talks about the peer pilot program, and then on the back it has the handy QR code to get in touch with us. So the answer to that is yes. And I'm interested if Dustin wanted to follow up with us as to what locations he might recommend.
All right, and then I ended our poll question. So answers are peer pilot mental health programs new. Yes, new to the helicopter community is 19%. No, airline unions have had success for over 10 years is 61%, and 20% are not sure.
Thank you. Now I'd like to introduce Mark, and Mark can talk a little bit about his background as well as his own journey and why becoming a USHST peer pilot was an important move for Mark, and to go through the training and what he got out of that experience.
Hey, good morning, everybody. Thanks for Chris and everybody inviting me on to today's webinar. Great questions. Just you saw my bio. Just real quick, I've been flying since 2009. Ag world, switched to EMS world in 2019. Got a few airframes under my belt. the Huey A and B variants, and then the Long Rangers, and now currently flying 407 GXs in EMS. So yeah, it's I we'll get into a personal story here in a few minutes, but just leading up to that, yeah, I was always, that pilot, as much as probably a lot of you guys that were worried about the FAA and, keeping our licenses and, not losing it for what we put on our medical forms before we go to do our recurrent stuff. And just, yeah, I got involved with NEMSPA, National EMS Pilots Association. I've been a member of U.S. Helicopter Safety Team for a while, and saw the CAP and this pilot peer support program come out, and thought with my experience that was something I definitely wanted to get involved with. I'm quite passionate about pilot mental health, and especially in the workforce. It can be, you guys have already touched on it, so I won't get too far into it, but, we all have outside of work issues, right? We got like family stuff going on. We got actually, in-house stuff, with EMS, we're up different hours, taking flights at different times of the night, and just a lot of things going on in our personal life. So, it's important to be able to, I feel very important, and passionate about having pilots, fixed wing and rotorcraft, to be able to have an outlet, right? Have some place they can go that they know it's a safe place. We've all gone through significant training with our peer support with CAP. Adrian, Jessica are great. Being recurrent every year is kind of like, with pilots, we get recurrent every year. So just something I really wanted to get involved with. I'm honored to be one of the pilot peer support people. We got several pilot peers, different backgrounds, EMS. We got some search and rescue guys, CFIs, fixed wing, rotorcraft, just reiterate what Chris is saying. It's not just for rotorcraft. I mean, it's fixed wing, mechanics, anybody that's has these issues, or they just want to be able to talk about it. It's really important to know that it's open to everybody. It's not just helicopter pilots. Med crew are part of it as well. I kind of promoted at my base where I work. Actually, I'm talking with one of our coworkers now, so it's really good to be able to let them, vent, get off their chest, and with no repercussions. Other than that, so real quick, my wife and I 3 years ago lost our then 13-year-old son to suicide due to bullying at school, and the company I work for just really no support for myself or my wife, who was a flight nurse at the time. Once our PTO ran out, we were getting phone calls, get back to work, just hounding us to get back to work. And I just thought, that's, a month off is not enough time to deal with something so tragic. And, 2 a.m, you get a scene flight. How was I supposed to deal with that, right? How can I keep my crew safe, get us back to base safe with all this stuff going on, and just not having nobody to talk about? So, bullying isn't just at school, right? I have switched companies because of being bullied by upper management several years later. And I just thought, this is not the environment that I want to be in. So I parted ways and moved on. So, it's more of a tribute to my son and to my wife and other people that might be going through the same tragic loss. I'm here to tell you that our peer pilot program is very instrumental, and just can be more proud to be part of this organization. So with that, if any other questions I can ask off air, it's fine. But hope that works there, Chris. I'll send it back to you.
Mark, thanks for sharing that. And it's a very powerful message, and we're lucky to have you.
Well, thank you. Appreciate it.
So we're getting some questions that are coming in. Some of them I can answer, and some of them I can't. And unfortunately, if I start typing on some of them, it makes the presentation kind of jump around and freeze. So, Laura, do we have time for a polling question?
We've got two more poll questions. I've got them teed up and ready to go. The first one is, are there any costs associated with the U.S. helicopter safety team? Any costs associated for members? And the choices are yes, no, and not sure. We'll let those answers come rolling in, and then I will end this poll in 5, 4, 3, 2, 1. And I'll share the results. Are there costs associated with the peer pilot program for USHST members? 3% said yes, 81% said no, and 16% said not sure.